pulse rate for a healthy adult should be between A. 60-100 bpm, B. 50-110 bpm, C. 70-90 bpm, D. 80-120 bpm. Testing for which of these does not fall under the chain of custody procedures? A. Paternity, B. Evidential DNA, C. Narcotic urinalysis, D. Pregnancy. Which of these would be best placed under the heading of medical etiquette? A. The way you talk to a patient, B. The way you decide on a patient's treatment, C. Obeying the law regarding patient confidentiality, D. The way a patient's medical fees are calculated. In Erikson's stages of human development, a young adult who maladopts in the intimacy versus isolation stage is in danger of what? A. Psychopathy, B. Paranoia, C. Psychosis, D. Promiscuity. In putting a patient into the lithotomy position for examination, how should they be positioned? A. On their back, heels above hips, B. On their front, heels above hips, C. On their side, completely level, D. On their back, heels below hips. Which of the following would be categorized as a flat bone? A. Vertebrae, B. Metatarsals, C. Femur, D. Scapula, E. Mandible. Freud's theory that patients may deceive themselves about the seriousness of their illness is known as what? A. Denial, B. Acceptance, C. Passivity, D. Aggression. What does the word antenatal mean? A. After birth, B. During birth, C. Before birth, D. All of the above. Which of the following would be a direct result of lipid depletion in the human body? A. The increase in the amount of proteins secreted in the body, B. The decrease in the amount of estrogen produced, C. The decrease in the permeability of the cellular membrane, D. The transfer of nuclear membrane lipids to the cytoplasm. If the name of a condition ends with the suffix itis, what does that indicate? A. Inflamed, B. Shrinking, C. Broken, D. Dying. Having your hands in your pockets when talking to a patient may be regarded as what? A. Aggressive body language, B. Dismissive body language, C. Attentive body language, D. Any of the above. Patient makes his/her condition worse by ignoring medical advice that may be considered A. Patient negligence, B. Contributory negligence, C. Patient malpractice, D. Secondary malpractice. If a patient cancels an appointment, it is essential that you A. Check if they need to reschedule. B. Bill them for the canceled appointment. C. Remove their record from the database. D. Mark their record as closed. Which of these is most important when dealing with medical records? A. Accessibility. B. Confidentiality. C. Legibility. D. Availability. Which of these is the only one entitled to immediate access to patient medical records? A. The patient's physician. B. The patient's lawyer. C. Law enforcement officials. D. The patient's insurance company. Which of these is the only risk a computer cable may not present? A. Flood risk. B. Trip risk. C. Electrocution risk. D. Fire risk. Who should explain the costs of their care to a patient? A. The physician. B. The nurse. C. The insurance company. D. The administrative staff. Circumstances should a patient's blood be considered infective or infectious? A. If the patient is homeless. B. If the patient is an intravenous drug user. C. If the patient is from sub-Saharan Africa. D. In all circumstances. Which of these fluids presents the greatest risk of HIV infection to medical workers? A. Saliva. B. Blood. C. Semen. D. Mucus. To ensure accuracy in testing, all equipment must be properly A. Calibrated. B. Cleaned. C. Catalogued. D. Costed. Some simple tests fall under waivers from which of these bodies? A. AMA. B. FDA. C. CLIA. D. SMB. In order to prescribe controlled substances, a medical practitioner needs a license from A. The FDA. B. The DEA. C. The FBI. D. The AMA. If a patient has a problem such as deep vein thrombosis or pulmonary embolism, they may need a drug to stop the blood thickening. This is called an A. Antihistamine. B. Antipsychotic. C. Antitussive. D. Anticoagulant. A normal pulse rate for a healthy adult should be between A. 60-100 bpm. B. 50-110 bpm. C. 70-90 bpm. D. 80-120 bpm. Which of these is the most common and effective place to read a pulse? A. Carotid artery. B. Femoral artery. C. Radial artery. D. brachial artery. If something is described as dilated, it will be A. Closed up, B. Expanded, C. Trembling, D. Collapsed. What is the primary function of melatonin? A. To produce pigment for the skin, B. To regulate the fight or flight response, C. To regulate sleep-wake cycles, D. To stimulate protein synthesis, E. Initiates sperm and egg maturation. In Elizabeth Kubler-Ross's theory, how many stages of grief are there for a patient diagnosed with terminal illness? A. 4, B. 3, C. 5, D. 6. The limbic system of the brain is responsible for the regulation of A. Vision, B. Emotion, C. Motor movement, D. Speech production. If a condition has the suffix penia, it means A. Excessive, B. Hot, C. Damaged, D. Lacking. Which of these refers specifically to the study of ways of coping with death? A. Psychotherapy, B. Thanatology, C. Genealogy, D. Parapsychology. Which of these applies to a person issued with a subpoena in a medical law case? A. They must appear in court, B. They may appear in court if they wish, C. They do not have to appear in court, D. They must stay away from the court. At the beginning of each working day, you should check appointments. A. Against patient records, B. Against billing schedules, C. With each team member, D. With the head of the practice. When a physician asks you to write up their record consultation, you are acting as A. Recordist, B. Clerk, C. Transcriptionist, D. Secretary. A discharge summary report must include what? A. The patient's financial account, B. The patient's final condition, C. The patient's insurance details, D. The patient's next of kin. Who is generally responsible for making sure that medical personnel keep their professional status up to date? A. The personnel themselves, B. The office administrator, C. The state medical board, D. All of the above. Petty cash may not be used for which of these purposes? A. Purchasing office sundries, B. Advances on staff salaries, C. Paying excess delivery charges, D. Paying cab fares for staff on office business. What does the Department of Health say that the chance of catching HIV from a single needle stick injury is? A. 3 in 1,000, B. 10 in 1,000. C. 100 in 1,000. D. 200 in 1,000. Used sharps should be disposed of in what? A. Ordinary trash. B. Thick plastic bags. C. Any sealed container. D. FDA-approved containers. Testing for which of these does not fall under the chain of custody procedures? A. Paternity. B. Evidential DNA. C. Narcotic urinalysis. D. Pregnancy. When placing electrodes for an ECG test, which of these is the only factor that does not require consideration? A. Patient scars. B. Patient ethnicity. C. Patient piercings. D. Patient stents. If a drug is administered transdermally, it is received how? A. Through the skin. B. Through the mouth. C. By injection. D. By suppository. What are drugs designed to cause vomiting called? A. Diuretics. B. Anesthetics. C. Antibiotics. D. Emetics. Which of these is not part of the measurement of vital signs? A. Temperature. B. Respiration. C. Pulse. D. Sweating. If a patient is displaying any abnormalities in their vital signs, how should this be reported? A. On the patient chart. B. To the patient. C. To a physician. D. Any of these. Which of these would be best placed under the heading of medical etiquette? A. The way you talk to a patient. B. The way you decide on a patient's treatment. C. Obeying the law regarding patient confidentiality. D. The way a patient's medical fees are calculated. A palpation examination is performed by A. Feeling. B. Striking. C. Looking. D. Drawing fluid. Which body part is not part of the acronym ENT? A. Eye. B. Ear. C. Torso. D. Throat. What areas of the brain are the most affected if a person is unable to understand written or verbal speech? A. Wernicke's area. B. Broca's area. C. Occipital lobe. D. Parietal lobe. Which of these terms means stopping breathing? A. Abiosis. B. Adenitis. C. Arthralgia. D. Apnea. What would result following an injury to the phrenic nerve? A. An inability to stand. B. An irregular heart rate. C. An inability to control breathing. D. An increase in body temperature. E. An increase in facial spasms. In law, what does respondeat superior mean? A. An employer can be held responsible for employee actions. B. Employers are not responsible for employee actions. C. Only employers are responsible for employee actions. D. Employees are the only ones responsible for their actions. What is a tickler system used for? A. To interrogate the patient database. B. To alert staff to database errors. C. To organize patient billing. D. To remind patients of appointments. Who has ownership of a patient's medical records? A. The care provider. B. The insurance company. C. The patient. D. The state medical board.